Arkansas is a hugely rural state, and so many of our patients are in rural areas. And so with that, you get people who don't necessarily have ready access to primary care.
There are several health barriers: access to health care, getting insurance coverage, and getting Medicaid, transportation issues. And of course, having English as a second language, so not understanding language, not understanding the system. A lot of chronic conditions, specifically diabetes, hypertension.
We have a maternal health care crisis here in the state of Arkansas. We're down to 32 hospitals that provide labor and delivery support. And so what that means is women are having to travel great distances to get the care that they need during their pregnancy. I feel like in life we're always told, meet me here. I have resources, come here. If you come here, then we have all of these resources for you. But what about the meeting them where they are? And I think it's a very valuable piece that is missing in our maternal health care space.
Arkansas, the state that we call home and that we all love so much, also has many health challenges. We must rethink how healthcare is delivered, whether it's expanding support for doulas and community health workers or bringing care directly to people through mobile health services. But we're fortunate to live in a state filled with dedicated organizations like UGMA, the Arkansas Community Health Workers Association, and Community Health Centers of Arkansas, and so many more organizations who are rethinking healthcare. These partnerships are essential to reaching people where they are, bridging gaps in access, resources, and trust.
Our belief is that community health workers are a great strategy to reach populations that are struggling with access, have barriers to care, transportation, having social needs that are impacting their care.
Community health work model in Arkansas is fairly new. It's basically a game of creating a path and letting people know that there are healthcare professionals called community health workers and that it is a profession and that we are people that know about the healthcare system. Our office is your community. My desk could be any library. It could be any community center. And my scope of work is every single person that lives in our communities.
So for us to actually show up at their church, they see that there's an effort for UMS to come and help them.
This interesting thing about rural communities, it's all about relationships. They really need to know who their providers are, they need to know who the clinic is, and they need to know that you're invested in them. And so it's important for patients to see us, be able to feel us, touch us, and know we're real people, and we are invested in them. Our partnership with the UAMS Institute for Community Health Innovation has been wonderful. They have a focus on the community the same as we do. And so many times our focuses will overlap and we have times when we can get some really good synergy. The other thing is they have been able to provide us with data. And so the research side of it has really been robust for us to look at the numbers, to be able to look at the data that we have and then act on that.
Through this partnership, women have access to be a part of the change. And that, my friend, is part of our solution. This is how we move forward. This is how we grow. This is how we change. And this is how we move the needle on maternal health care. One family, one community, one doula, one provider, one midwife, one labor and delivery nurse, one labor and delivery hospital at a time. We're doing it and we're doing it together. And I'm grateful for the Institute's portion and their part in supporting that change for Arkansans.
We can make a difference and reach people where they are and ensure that all Arkansans have the opportunity to live healthy lives. Improving the health of our communities takes all of us, working together, listening to one another, and building solutions that reflect the real needs of Arkansans. Through strong partnerships and shared commitment, we can create lasting change and ensure every community has the opportunity to thrive. Because when we work together, healthier futures are possible for everyone.